people feel like they need to get their pre-baby body back. And I really like to empower people that your body is supposed to change. So whether it's during infertility, during IVF, during pregnancy, your body is actually meant to change. We want those changes. If we're trying to get pregnant, we want those changes. And I encourage people to celebrate them. And social media can make it really hard. Celebrate the body you have now and what it's trying to do for you or what it has done for you. And then know that you can even be stronger in the future.
Balancing myths, recommendations, and reality in infertility can be confusing, especially when it comes to fitness and exercise while you're trying to conceive or in pregnancy. Everyone seems to recommend something different, and you can feel stuck trying to do what's right. Here to discuss fitness and fertility is licensed physical therapist and Pilates teacher, Jessica Valant. Jessica, welcome to the show.
Thank you so much for having me. I'm so excited to be here.
Well, I'm a I shouldn't say lifelong, but over a decade Pilates practitioner myself. I absolutely love it. I have seen you along with 500,000 other people on YouTube, just an incredible channel. You just give such a wealth of information. And most of your videos are so upbeat and they're really guiding through great exercises. But you've been really open about sharing about your own fertility journey, your diagnosis of endometriosis. And I'm really curious, and I'd love to hear more about your experience and how fitness has woven in and out of your journey.
I became a physical therapist in 2000, and I, up until that point, had been pretty healthy. I would call myself healthy. I started having a lot of pain, back pain, a lot of things going on, multiple tests. Probably a lot of people can kind of relate to unknown diagnosis, going to the ER. And I was a PT at that point. But for myself, I had just been working out. I was that typical, I ate a bunch of donuts, I'm going to work out harder. Like that's how I attributed exercise, very much so. You exercised to work off calories, period. That's how I grew up. I grew up with Special K all over the place and Slim Fast. That's what I thought.
Oh my God, you're speaking to my childhood and then hearing my mom talk about Weight Watchers. Yes. That is what I grew up with too. Yep.
Yeah, absolutely. I mean, I'm a child of the 70s and 80s, and that's what I thought. And then becoming a PT, I knew movement had a purpose for healing. But again, it was very much by the book. You know, you have a rotator cuff tear. This is what you do, period. So I started to go through it, and it took quite a few years and a lot of tests and a surgery to be diagnosed with endometriosis. And I remember waking up not knowing what it was at all. Nobody really. More people do now, but at the time, definitely not. And I remember one of the biggest things I heard was, it doesn't go away. We can't cure it. You're going to have to find a way to manage it, and you'll have a hard time having kids. And to me, I had always wanted to be a mom. That was a big thing to me. How do I manage this? And I put everything I had into learning how to manage it. And that was really my first step into realizing what movement could do for healing and for pain management, and really to become a part of my entire healing process. And so for myself, that was a big change. My husband and I were actually able to get pregnant with our daughter naturally after 5 months. I mean, a miracle. No doctor thought we'd be able to. And looking back, it absolutely was a miracle. Every child is a miracle, but that especially. And then I had in my mind, of course I'll be able to get pregnant again if you can the first time. And we couldn't. So we tried and we tried and we tried. And at this point, I was 35 when we had our daughter. So I was 38 at this point. We had been trying for a couple years, had another surgery for my endo, woke up and was told, you have a frozen pelvis. It's pretty bad at this point. You're going to need IVF. And so that took us into a fertility journey that I never saw coming. I probably should have with endo, but I didn't. And so a few years of IVF and multiple failed IVF cycles, being told we had a 10% chance. We took it, and our son is here now. And that was my journey. And then the endo continued, and I've had a hysterectomy at this point and prolapse repairs. But that was really where I was with the infertility piece. And honestly, I call it movement now more than fitness, but only because I feel like fitness is a smaller word to to what movement can be in our lives and what it became for me. It really became a touchstone throughout everything I've been through medically and all the questions and all the dark places. That ability to move my own body, whether it's a walk outside or on my mat, really became one of the only places I felt like myself during a lot of that. And so I talk to clients a lot about that, about what does movement look like? Not just fitness, not just exercise, but what does movement look like in your body? And how can you start to take some power back? Because going through infertility is a very powerless experience.
I love that you see the power in language and words. And you're exactly right. Fitness can, in some circles, have a lot of a negative connotation if you're associating fitness with looking good or whatever magazine cover has the word fitness on it. And you are absolutely right that it's more about movement and healing and how it can look different to different people. I really appreciate your pointing that out.
We hear the word fitness and we think, oh, but I'm not fit. And I say that in air quotes, everyone listening. That's not a real word, but we think that, right? We think, oh, I'm not fit, so fitness isn't for me. Or we think exercise and we think then exercise classes and that's not for me. But everybody can sit and think of how they move their body every day. And every movement is valuable.
Do you remember what you were advised when you were going through fertility, maybe when you were trying to conceive or definitely through IVF?
Moving during infertility and IVF was so hard because of exactly what you said. There's either a lot of conflicting information or there's just no information at all. So especially someone that, like I said, movement was a part of me staying healthy with my endo. So I knew I needed to. And also movement was literally my job, being a physical therapist and Pilates teacher. I didn't see a way not to move. And it didn't feel natural to me not to. So when they talk about that, I always bring up to people that stress is obviously a big component of all of this, and fear. Going through infertility is you're almost always in fear of something, fear of it not working, fear of your body changing, fear of what the shots are going to feel like, so much fear. So I want people to honor that first. If they have fear around any of it, honor that, like listen to that. That is not something to ignore, and it is okay if you feel that way. I will say my exercise during my second pregnancy looked much different than my exercise during my first. And I think it's because I suddenly saw the fragility in pregnancy the first time around. I got pregnant easily. It was okay. I didn't have that fear. And the second time I did, because I knew what could happen if I had lost a baby. My son through IVF was a twin, and we lost his twin. So my exercise looked very different because I had that fear that I didn't. And instead of telling myself, no, you have to still go hard, I just had to honor that and say, this is where I am now. So anyone listening, honor that if you have it. It's okay. And also realize that movement has a very valuable place in a healthy pregnancy, in you staying healthy, in stress relief and management and all of that, and you just feeling like yourself still during a crazy period of time. So there is a lot of confusing information out there. First and foremost, I do tell people to talk to their own doctor, because doctors are different. They have different procedures, and they might have a reason for telling you what they tell you, whether it be don't move, for 2 weeks, or don't move at all, or don't run, but you can walk, or just don't move during the 2-week wait. There's so many different things you'll hear. So first, ask them, because they really might have a reason for it. Second thing is ask them why. Do not leave that room until they have told you why and given you details. Because the biggest thing you'll hear is, do whatever feels right to you. And that is the hardest, most confusing thing to hear. I don't know what feels right to me. If I did, I wouldn't be here, doctor. So I need a little guidance. Then if you leave and you haven't been given the details that you want, see if you can create a team. I had a reproductive acupuncturist that I worked with for a year throughout it, and she was invaluable to me. I would take the information I had from my doctor and then go to her and say, can you help me interpret this now? Because even being a PT and having the experience I had, it's really hard to interpret it when you're the patient, It's really hard to take the layers of fear and sadness and confusion away for yourself. So to have someone you can trust who isn't just your neighbor down the street, like you said, I think that's another piece of advice I would have. And then really ask yourself what you need to be your best self during that time. So for me, I really had to say, okay, indoor cycling classes, do I need them? That's actually not what I need. I would love to keep doing them, but if it's a question, if I'm unsure, I don't need that. Do I still need to walk outside in the fresh air? Yes, 100%. I can't let that go. I will not be a good person. I won't be a good mom to my daughter. So there were a few things like that I really looked at and said, these are the things I still need, that I need to find a way to incorporate it. And I did. And the rest of it, I was okay letting go for a while until my body settled again.
In my IVF cycle, I just couldn't even keep my eyes open after 7 p.m. I was just exhausted. She just might not feel like being really active.
Yep.
But I feel like moving is important. So I am trying to learn from you. I'm thinking into myself, when someone asks me, what can I do? I do actually always ask them, well, what do you do? What do you enjoy? Because it's so different if someone's like, oh, I run, but wait, how much, how long? Because I do have patients that run 100 miles a week, which is just like, that sounds amazing and crazy. And then I have other people who are like, yeah, I run, and they run like, a mile or two at a time and like a light jog. And that's just very different.
And for me, the way I kind of looked at it was, I want to keep my body as status quo as I can. And for me, status quo or normal life was moving every day. So if I had suddenly stopped, that actually would throw my body into a place I'd never been before. It didn't sound healthy to me to go to that place. On the other side of things, it can be easy during that time. You've been there during that time of confusion and just not knowing. You almost sometimes want to throw yourself into something new. And then I get so many clients who ask about the weight gain, possible weight gain. I know that's a fear people have, understandably. And so sometimes we go to the other place of, well, I can't control anything else, so I'm just going to do a new workout. Like, I'm going to start CrossFit all of a sudden. I'm like, well, that's probably not the best idea either, because your body's also not really used to that.
Right.
So I think there is that fine line of finding what you're used to and what your body is already able to do, and just really asking questions of, is it normal for me to continue this? Like, does it feel normal to my body? Is it not exerting myself maybe too much? And I don't know exactly what too much is, because there is a lot of gray area. There absolutely is. But those are the kind of questions you can ask yourself. Yoga type stretches and Pilates, certain type stretches, any kind of twisting. I just kept that out because of that. And it was just uncomfortable. I mean, my body didn't want to do it anyway with the bloating and the swelling from the ovaries. So I think if we listen to our bodies, sometimes they will help guide us. I'm not saying that's the only source of information, but our bodies can help tell us a little bit too.
It's hard because as the doctor, I don't want to take away a stress management technique. I don't want to take away any joy, because I think if we take away too much joy, like tell everybody they can't ever drink a glass of wine, or they can't ever have a piece of cake, or they can't ever run again, they're going to stop trying because it's just too hard. But there really is evidence that serious long-term running, even if you still have your period, even if your BMI is okay, really does change hormones and change reproduction. And so have you had clients like this, and have you talked them through? Because they're probably coming to you even more than me.
Yep. I do. And I see it a lot just in physical therapy too. I mean, knee injuries, same, same, shoulder, all of it. And I am the exact same. I tell people I do my best not to take anything away from you. I try to just add and adjust, and I don't want to take anything away. But there are times that we need to take a break. And I do think there's sometimes a bigger picture, and I just see it in myself. That's all I can say. When I need to move every day, and I get to bed at night and I'm like, oh my gosh, I feel it. I feel that I didn't move my body. That's a question I ask myself even. Okay, why? That's an interesting little trigger feeling. Like, I should probably be able to go a day without moving my body and feel okay about it. And so sometimes and I'm not a therapist whatsoever, but I do think there's a lot of layers to that, to why some of us look at moving to cope versus, other people look at different things. Like you said, eating or cleaning the house or whatever it is. We all look at different things to cope. And I can say that infertility will throw you into a place where you need to find some other ways to cope. And I didn't like it, but I had to do it. I mean, instead of having a glass of wine, I made this detox tea every single night. And by golly, I was so resentful about doing that at first. And then I learned to love it. It just became this ritual for me. And I missed it when it was done. And it was probably a good exercise for me in finding a different way to cope during a hard time. So that's one thing I will say is there any other way you can look to cope? Does it have to be movement right now? And then another thing is, this is not permanent. This is not forever whatsoever. And give yourself a time if you need to. I mean, our bodies don't always listen when we give it a timeline. Sometimes it will be a lot longer than we think. But if you are someone that you need that deadline, tell yourself, I'm going to do this for 4 months or 6 months, whatever it is. Give yourself that amount of time. And sometimes it just helps our brain actually, like research shows, that's why we set goals with specific timelines, because having a deadline or an end date helps us be able to actually accomplish that goal a little more. One other tip I tell people is really look at, what is it about the running or the activity that you love so much? Is it actually the actual running? Or like you said, is it the endorphins? Can we find that another way? Is it just getting outside with a playlist by yourself because it's your only me time during the day? Can we find another way to do that? Is there a really cool hike nearby? That was another tool I used. I couldn't run, but I made a playlist and I listened to that every single day, and I went out for a walk or a hike. Our bodies just need different things at different times, even things that look really healthy. Sometimes we just need to find something else to honor our body during that season of life, and then we can move from that season to another. Because you will, no matter what, IVF is a season of life. It does not last forever.
I'd love to throw out some really dogmatic statements that I've heard from people. I have heard other doctors recommend to patients. And I just love for us to kind of think through how we think about these things.
Yeah.
Because these are some of the things that you will find in the literature, on Instagram, just everywhere. So, number one, stop exercising completely when you are trying to conceive or early pregnant. What do you think about that?
I just don't understand it. And you sent me that earlier today, and I'm like, I am going to research and find out where that came from, because I really want to know. And it's not out there. You can't find where it came from. I actually wanted to find the first time that was ever said, and I probably didn't dig deep enough to find it, but I can't find where it originated, and yet it is all over. The research does not support that. That's what I can say. Studies and research 100% do not support that. I will also say, yes, there are high-risk situations. So again, you need to listen and ask your doctor. And if they do give you that advice, ask why. And if they don't have a good answer for you, you go find another doctor. There are studies that show it's not only healthy for the mom, it's actually healthy for your baby, for you to move and exercise. Babies are born with healthier hearts whose moms are exercising and moving during pregnancy.
Myth number 2, or just really blanket statement that a lot of people hear. Number 2, keep your heart rate under 140 and you'll be okay.
That's a hard one for me, because I could probably find reasons for certain people absolutely to keep their heart rate under 140, but it's not a blanket statement you can make, because everybody is different. It depends on what someone's resting heart rate is. It depends on how they were working out before pregnancy. That's a big one. Like, I probably wouldn't take someone who's sedentary before pregnancy and recommend that they go get a really high heart rate during pregnancy. But overall, our recommendation is not to try or start something new during pregnancy. So that's a hard blanket. I would never make that blanket statement. Yeah, there are probably some people that's a recommendation for, but again, that just causes fear. Any blanket statement that causes fear is not a good statement.
People who are really, really active, they probably never get to a heart rate of 140.
Right.
I bet Venus Williams won the Australian Open in her first trimester of pregnancy with a heart rate under 140.
Oh, yeah, exactly. Because she can control it, because that was her status quo, or that was where she was beforehand. I think
Good
that's
point.
the biggest question to ask is, yeah, where were you before? What was normal for you before? And you're probably safest continuing with those kind of activities. I mean, unless they're surfing. I lived in Hawaii for my first pregnancy. That made sense to me. Like, don't surf after a certain point.
Right.
Same in Denver. Don't ski after a certain, like, those things make sense to me. Yeah, I don't want to fall on my belly.
Right.
But yes, going to a dance class that I did for 10 years during pregnancy, it's probably okay, really.
Okay, number 3, exercise as much as you want. As long as you're getting your period, everything's okay.
So before pregnancy, you mean, if they're told that, like when they're trying to conceive? Yeah, that one too doesn't make any sense, because getting your period isn't necessarily an indicator of a healthy reproductive system. I got my period for a long time regularly, but I was on the pill. So I thought I was healthy.
Yeah.
Then I went off and, oh gosh, that all hell broke loose. And then I got myself regular, and endometriosis had ravaged my system. So if I used my period only as an indicator for a healthy reproductive system, I would be in trouble. So I think that's one thing. And then 2, exercise as much as you want. I think that is just, again, it's person by person by person. Some people are going to be fine doing the high intensity, crazy stuff, and it won't affect them whatsoever. And then some of us not so much, especially autoimmune conditions, those kind of things. It's a different what our systems can handle. So if you've lost your period, that's a red flag for you, definitely, on whether it's your exercise or not. You won't know without more testing. But yes, that's a big flag of, okay, I need to figure this out. And then also don't assume just because you're still getting your period that everything else is okay. You know, me being 38 when I went through IVF, I was still getting my period. I thought it was fine, and then saw, oh, I don't have many eggs left in there once they did the testing. So it is important. Again, it's just one more piece of information, but you need to dive deeper. You need to find out more, and you need to just take ownership and know that you're the one that's going to have to advocate for yourself.
Number 4, maintain this BMI, and I put in air quotes because everybody will have their own opinion on that, and you'll be fertile. That's the end all be all of predicting whether you're fertile or not.
The first thing I'll say is there are plenty of really good arguments right now going on in the medical world that we should eliminate the BMI altogether. So that is my opinion, is that the BMI, and if you look back at the history of it and how it was developed, it doesn't make sense anyway. So I don't think the BMI itself is a good indicator of health. It really doesn't tell us very much. That being said, yes, there are also studies and research shows that your weight alone can impact fertility. And I won't say more than that because that is not my expertise whatsoever. But that is something, if you are having a hard time conceiving on either end of the spectrum, weight-wise, that might be something you want to talk to your doctor or a professional about. But don't let, again, the BMI is a fear tactic. Don't let someone take your BMI and suddenly tell you aren't healthy because of that result. It's not an indicator of health.
People can be fertile at different BMIs. Like you could be standing next to somebody at the grocery store and that person could be twice your body size and they could have like 5 little kids in their grocery cart. And you could be less weight. So like that person, anyway, it's just not black and white. You just can't make assumptions. I do want people to be healthy. And I do think having a really high body weight puts, your blood sugar, your high blood pressure, cardiovascular disease, like all those things. But it doesn't need to be a discussion centered on shame.
Right.
But it does need to be discussed in a supportive way.
Yes. And from an expert too. And that's why I'm the first to say that is not my expertise. It's not in my scope of practice as a physical therapist. So if you are listening and you're out there following people on Instagram and social media who are talking about nutrition and weight and they are not certified to do so, find someone who is certified to do so and will do so in a very, supportive way in your lifestyle. That's the important thing. They need to be certified and trained to talk about it.
If there's one person in their life that is going to listen to them talk about their pain or their difficult periods and say, hey, that sounds off, right? Yeah. Or they say, oh, I haven't had a period in 3 months. Whoever is listening to you just says, I was listening to this podcast and maybe you should, talk to somebody about that. I just really hope that people can be empowered a little bit more.
Absolutely. And it validates that person because then, like you said, they know they're not alone. And it's the same, not just infertility, but I work with women in so many different places. It's the same with incontinence and pain with sex and prolapse, rectal prolapse, these things that are embarrassing and that we get so ashamed of. But once we say it, we realize we're not alone and it loses a little bit of its power over us. And I think as practitioners too, the other key is realizing you can't always fix it. And infertility is a big one with that because that's the hardest part. We can't fix it. We can't guarantee an outcome with IVF ever. You can hope for an outcome, but you can't guarantee it. So I tell practitioners, it's really not your job when a woman comes to you. It's not your job to fix their infertility. You can't do that. But yes, it's your job to listen and to have a team of support for that person because you might be the only one that they talk to that week about it. So just listen. Continue your Pilates. That's what your expertise is. Continue teaching them Pilates because it might be the one source of joy that day for them that they can get away from that infertility piece. And it can be really powerful. So there's only one other thing really that I like to touch on, and it's that idea of that people feel like they need to get their pre-baby body back. And I really like to empower people that your body is supposed to change. So whether it's during infertility, during IVF, during pregnancy, your body is actually meant to change. We want those changes. If we're trying to get pregnant, we want those changes. And I encourage people to celebrate them. And social media can make it really hard to celebrate those changes because we're always comparing ourselves and we see women who are still, like you said, running marathons throughout their whole pregnancy, or women who don't have a hard time getting pregnant, or people who after pregnancy, I had severe prolapse afterwards, and there are women who don't, and that still blows me away that other people don't break during birth like I did. Oh. But it's true. We are all different. So don't compare yourself. Don't even compare your body to what it was 9 months ago or 2 years ago. Celebrate the body you have now and what it's trying to do for you or what it has done for you. And then know that you can even be stronger in the future. I feel stronger now after all of this than I did 10 years ago before I went through it all. And so celebrate whatever your body is doing for you now and move forward knowing that. But don't let anyone try to tell you you need to get your body back from before, because whatever you have now is even better than that. So if we can actually celebrate these warrior women who are going through that, and if you're going through IVF, you're one of those warrior women too. What your body goes through, you are a warrior, and find your strength because it's there.
I hope you enjoyed that conversation with Jessica Valant as much as I did. I just appreciated so many points that she made, and especially the point that no body is the same, and there's no one recommendation that fits every person through infertility and early pregnancy. So talk to your doctor, advocate for your care, and find the right movement for you. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. Baby or Bust is produced by Mark Ramsey, Jamie Solis, and Greg Moga. Executive produced by Paul Anderson and Nick Pinella for Workhouse Media. Baby or Bust is a Mark Ramsey media production.